Hi everyone and welcome to today's episode of the vlog series. Today we're going to talk to you about the PLAB route to GMC registration. So the GMC have lots of different routes to become registered with a license to practice for them. The first is PLAB, you've also got the Royal College route, and then you've got the MTI program as well. PLAB is aimed at more junior doctors, so usually at the entry point of an F2 level doctor or equivalent to that for a UK based candidate. So this is the route that junior doctors are going to take to gain their GMC registration. So the PLAB examinations are for doctors who have completed their primary medical qualification, ideally sat IELTS or OET as well to prove their English language skills, and they'll have graduated outside of the UK or the EU. There's different pathways for the UK doctors and different pathways for EU doctors. So this is IMG focused. You'll also note that it is aimed at F2 through to usually ST1-2 level doctors as well. So you'll have graduated and probably completed your internship and maybe 1 or 2 years of post-graduation practice as well. So if you're looking to sit these exams and you're a more senior doctor, it's not that you're prohibited from sitting them, but you might find that there's a better route for you, which perhaps would be one of the Royal College examinations, because they're aimed at a more senior level and doctors that have got experience practicing in a specific specialism. They would give you access to roles at an ST3 plus level. So basically, PLAB for junior doctors and Royal College route for more senior ST3 plus level doctors. So the PLAB 1 exam is the first part of 2 in the PLAB series. It's a multiple choice question with 5 options for each question. There's 180 questions and you're sitting at over a 3-hour period. So it's a long exam and it's worth preparing well for. It's going to cost you £255 and you can make the application on the GMC's website. There's also test centres all around the world, so it's a pretty accessible exam. You're not going to have to travel too far in order to find a test centre. In terms of making preparations for the exam, you're going to be tested on the clinical knowledge of a doctor entering F2 level in the UK. So it's pretty much going to be things that you would have learned during your medical degree and of course during your internship year as well. So it should be pretty straightforward. Don't underestimate it though. The most recommended place to look for preparation is the GMC's website for the GMC's PLAB blueprint. This outlines everything you're going to need to know for part 1 examination. But you could also have a look through the Oxford Handbook of Clinical Medicine as well. That's a great preparation tool for PLAB 1. PLAB 2 is a structured OSCE examination. So you do have to attend this one in person and the test centres are in the UK in Manchester. So you're going to need to get yourself a visit visa. We've got some separate information in our blog series on how to obtain a visit visa. It is pretty straightforward, and if you're coming for the PLAB exam, it's a well-trodden route, so you shouldn't have too many issues with that. Now, on the day itself, you're going to be assessed at certain stations and you'll do multiple stations across an entire day. You'll be tested on your interpersonal skills, your clinical management skills, your data gathering, assessment and technical skills as well. So it's an intense day and it's much harder to prepare for because of course you're not quite sure what patient situation you're going to be faced with. There are, again, loads of YouTube channels devoted to PLAB 2 preparation, and lots of people choose to go on a PLAB 2 course just before they sit the PLAB 2 exam. We would really recommend investing the time and energy and effort and money into sitting one of those courses. Because of course if you fail, it's a lot to reconsider having to come back to the UK, travel again, and you've only got 4 attempts in which to pass your PLAB 2, and they must be completed within 3 years of PLAB 1. So it's vitally important that you pass it as early on as you possibly can. In terms of cost, it's £974 at the moment to sit the PLAB 2 examinations. And again, all of the application is made online. You'll need to have completed PLAB 1 before you can apply for PLAB 2. So after you've completed PLAB 2, congratulations first of all. The next step, of course, is to apply for your GMC registration. That's all done on the GMC's website, but in order to apply, you're going to need to make sure that you've got your IELTS or OET certificates to hand, your primary medical qualification verified by EPIC ECFMG, as well as your certificates of good standing to cover any practice that you've done in the last 5 years. Hopefully that's a pretty straightforward process and much easier than the exams that you've sat over the last couple of years. Once you've done that, you are free to make your job applications on NHS jobs, or of course contact an agency like BDI Resourcing who will be able to help you with your recruitment and relocation to the NHS. So in summary, the PLAB examinations are more aimed at junior level doctors. So if you're looking to come in at an FY2 or ST1 or ST2 level, then PLAB is going to be the route for you. If you're looking to come in at a more senior level, you might want to consider the Royal College routes. However, you're not prohibited from sitting PLAB, so if it's more accessible, you can still use that option. It's a 2-part assessment, with the first part being a written multiple choice questions examination, and the second part being a structured OSCE in-person examination that you need to travel to the UK for. Complete these two and you'll get your GMC registration. You'll be ready to work in the NHS.